Little after 9:01. So we're going to go ahead and get started. Welcome everyone. Happy Thursday morning. And welcome to our first WIHA office hour of 2024. I'm really excited to be with you all today. Get a chance to connect with you as well as an opportunity for you to hear from each other with all the great work that's happening around evidence-based healthy aging here in Wisconsin. So my name is Jill Rankin with the Wisconsin Institute for Healthy Aging. For those of you who don't know me, I've been around with the organization since it started, and really excited to welcome you all to office hours today. And we've got a nice packed agenda, and we're gonna try to incorporate everything into an hour, see how this goes. So if you want to go ahead and put in the chat your name and county you are from, or city, area, the state area of Wisconsin that you're from, that would be wonderful. And if anybody has joined us from our national partners, welcome. This phone call will be geared more towards the activities that are happening in Wisconsin, but you're certainly welcome to listen in if you would like. We're glad to have everyone here today. So go ahead and keep an eye on the chat to see which one of your colleagues are here with us today. And I'm going to go ahead and move on and let you guys know what we're going to talk about today. So here's the agenda. We're going to hear from our LEAF grantees. I think there's 4 of them that are going to be presenting today that you haven't heard from yet in previous office hours. Our LEAF grantees are those who received funding to advance fall prevention efforts in their community during 2023. So they're going to be presenting what activities, innovative ideas, and projects that they did, and the results that had occurred from those reports. So that will be exciting, and we'll hear from first. And then we're going to go through and discuss some WIHA fundraising efforts. WIHA has taken a different focus over the past year or so, expanded our focus, I shouldn't say different, expanded our focus over the past year to include more relationships with older adults and people as they age here in communities here in Wisconsin, and talk a little bit about our organizational fundraising efforts going forward. And then we will have an opportunity for you all to talk with each other, probably about 15 minutes or so, to have some discussion on program promotions and just some differences that we're seeing around the state, around the nation when it comes to program promotion post-pandemic. And then you'll hear from our WIHA staff for some great program updates. And so everybody will be all in the know of everything that's happening with all the programs. So that's our plan for today. And thank you everyone for entering your contact information or your introductions into the chat. So I'm going to go ahead and hand it over to Suzanne to introduce and welcome our LEAF grantee.
Awesome, thanks, Jill. So like Jill said, we did the LEAF grant project last year. The grant project ran from the first of the year to the end of August in 2023. And after that, we asked all of the LEAF grantees to submit a final report. And then I looked through all of the reports and then compiled them into a full final report that kind of includes some best practices, what activities they did, lessons learned, and their plans for sustainability. So then you all can look at that and see if there's any projects that you might be able to take back to your community and implement. So like Jill said, the goal was to support sustainable falls prevention efforts. We did have a focus on reaching underserved communities, which many of our LEAF grantees did. The final report is available on our Falls Free Wisconsin website. And Jill, if you want to just move forward one, that would be great. So part of the final report includes a table of contents and introduction, and you can see on the screen all of the grantees. There was 10 of them, and we'll hear from 4 of them, like Jill said today. And then if you go one more, Jill, this is what the project summary looks like for each of the grantees. So it's a really short report. You can kind of see at the top what the agency was and then what their goal was. So for the ADRC of Portage County, for example, their goal is to revitalize their coalition. So you can see what activities they did to do that, what partners they included, their lessons learned, and their plans for sustainability and next steps. So that's kind of how the report is run. You can see that for each of the organizations, and we'll hear from a few of them today. So First up, we have Anne from Oshkosh Senior Center. So Anne, if you want to go ahead and unmute. Did you want to share your screen, Anne?
Yeah, if I could, that'll keep me on track. You know how that
Yeah.
goes.
Perfect. And
Everybody
yeah,
can see that. I'm looking for how I expand it. You know, I haven't been on Zoom in a while, and I'm not going to say that that's a bad thing.
It looks great. We can see it. Pretty
Okay, awesome. Then I'm
Yeah,
not going
that'll
to
work.
mess with it. So I want to thank WIHA for the funding because it's rare that as a senior center, we get opportunities to really amp up and enhance programs that we've been dreaming about doing. And so I think we were super successful with the help of you guys. And I'll just briefly share with you guys what we did. We have partnered with the fire department in the city. They are doing a lot of research on falls and how much it costs the city to continually go to people's homes and basically pick them up. So they have been working with us the last 3 years really closely. And we have been putting programs together to say, what can we do to prevent falls? And then WIHA came along with the LEAF grant, and so just worked really well. The fire department had bought a biodex scan CD SD piece of equipment for us. And that's actually something you might find in a physical therapist's office. And it literally measures in 5 minutes your propensity to fall in comparison to seniors of your age. So it's really a cool awareness to kind of jump up on there and see, hey, am I doing what I'm supposed to do and my balance is good? Or am I in big trouble and I better, get a plan together right now? And it also helps measure progress. So you start at point A and end up at point B. Did you improve? So people are really excited about that. So we wanted to do a campaign to get the community aware of the programs we're running, and then get the awareness up within the senior community. So with the funding, we bought motion censored lights, and anyone who was measured on the biodex received the motion censored lights, and then all the programs available in the surrounding area to prevent falls. And then we entered them in our database because the goal is going to be to go back to those individuals and keep getting in touch with them to make sure they're still on track, if they're in the good position, or if they were medium risk. Have they come to the center? Have they started their programs? Come back. We want to see where you're at right now. Our goal was to scan 200 people, and we got to 177. I'm always the class is full, so I'm going to be way too optimistic, but I was really excited. So I'm using Suzanne's report because it sums it up really well. So we tested people, collected data, we ran ads with the funding to get people talking about it and to sign up for appointments. We had the opportunity with WIHA to meet State Senator Fyan because you guys were lobbying for some more funding. And it was a great meeting. We made him jump up on the biodex to be measured, and he was a real sport. and we're happy to say his balance is good. So I hope that all worked out, that the funding went through. I heard it was progressing, so it's awesome. Outcomes, 48% were at high to medium risk for falling. That makes you sad, but that is not a surprise in our demographics that we serve. Really good feel-good stories. 91-year-old basically was falling at home, and her daughter said, I want you to go to the senior center. And it started with us measuring her risk. We put together a plan for her, and she started Tai Chi classes, and she can't stop raving that she's no longer toppling over, sliding off her chair, etc. So I hope there's, of the 177, I hope most of them had that kind of result. Our next steps, we're going to use the data from the screenings for future programs. We're working out those details right now. We have a new senior services manager and a new fitness coordinator. And so stay tuned. We'll be going to phase 2 late spring, early summer. And I think one of the cool things we did is we actually took the equipment on the road and we set it up at the Senior Center Expo, and it was really fun. There was probably 20 people sitting around watching, but we actually screened 52 people on site. So that is now going to become something that we do on a regular basis, taking this portable equipment on the road. So that's my story. Any questions?
Thanks for sharing, Anne. It's really cool to see all the success stories and that story about that 90-year-old woman. Just, I love that.
Yeah.
Yeah. Any
Definitely.
questions for Anne? Feel free to drop them in the chat, come off of mute. And maybe Jill, we can talk at the end of this about the legislation too, because we would love to offer these LEAP grants again, since we saw so many positive things come out of them.
Yeah,
Awesome.
definitely be part of our update. Thanks.
Awesome. Thanks, Anne. Like I said, any questions, feel free to drop them in the chat, but then we'll move on to Susie with Milwaukee County.
Great, thanks for having me. I'm going to go ahead and share my screen if I can. All right, so hi, I'm Susie Ryer. I'm a physical therapist by background, and I co-lead the Milwaukee County Falls Prevention Coalition, as well as working within Advocate Health in Milwaukee. So I'll talk a little bit about our LEAF grant project, which was really focused on taking a faith-based approach to expanding fall prevention within our community. Are you seeing my screen? Perfect.
Yes.
Okay, so the goals of our project were really kind of threefold. One, we had identified that there really was a gap in where our stepping on programs and our other fall prevention outreach efforts were targeted, particularly a lack of representation within our communities of color, particularly in the north side of Milwaukee. And so we'd really identified that our faith-based partners, our churches, were really a great opportunity to bring fall prevention to the community rather than asking people to come to us, you know, in our healthcare systems or, you know, out into some of our suburbs and kind of outer reaches of our cities. So our goals were really to start to create some new locations and create those partnerships with faith-based organizations within the African-American community on the north side of Milwaukee, to try to target, you know, the kind of events we were bringing to those communities, and then ultimately trying to increase the stepping on offerings that were offered within faith-based organizations. Through our project, we created a new partnership with Soloa Lutheran Church, which is located on the north side of Milwaukee, in one of our zip codes that has the lowest socioeconomic levels and the greatest levels of health disparity. It's a really active church. And we worked with some of our partners within Aurora who had started some outreach with this church. We actually found someone within the church community who had a focus on trying to create a health ministry. And so this was a really nice alignment with the work that they were hoping to do to not only reach the community of the church, but really the community surrounding the church and wanting to really give back to that community. So we found this to be a really good partnership and a good opportunity to bring something to them. To really raise awareness, we were trying to take a different approach for how we could reach people. I think what we found was that some of our heavy focus on electronic and social media promotion for some of our other events has not always been as successful. So one of the things we did, certainly we created flyers, which you'll see on the left. We distribute those through some of our strategic partners, the senior centers that were close to the church, through the church kind of community as well. But then we also did a targeted mailing. And so we looked at the zip codes that were surrounding the church, and we were able to find any households that had someone 60 and older living in those zip codes, and then do a targeted mailing. And that was really successful in bringing people in who maybe were not aware of the programs or didn't know where to look. And so having that kind of direct contact was a really successful strategy for us. We also did some social media posting as well. So we really did two different events, or two different components that kind of built off each other. The first was our Stand Up to Falls seminar. And we really tried to take kind of a healthy aging and aging in place approach to fall prevention for this, and really promote things that people could do to stay active and stay living at home. One of the things, it was a mix of church parishioners and community members. And one of the things that we thought was really important was trying to have a diverse speaker panel. So we focused on fall screening, we focused on home safety, and we focus on exercise. So Dr. Chris Ford, in the bottom right-hand corner, is an ED physician that we've worked with for Walk with the Doc for AARP, and he was really engaging. The whole group loved him, and I think that was really nice to have representation within our speaker panel. And then from that event, then we were looking to then leverage that into trying to generate some participation in stepping on. So of the 20 participants that we had at the Stand Up to Falls event, actually 15 of them ended up coming to we had 15 in our stepping on class. I think 13 were from that initial seminar, which was great. We had a facilitator trained within the community who served as one of the co-facilitators for our stepping on class. And again, we were trying to bring in a diverse panel of guest experts for that class, and that wrapped up in December. In addition, we leveraged beyond our faith-based kind of strategy, and also did an additional event at our Washington Park Senior Center during Fall Prevention Week. That was building off of things that we've done in the past, but we were really trying to expand that outreach. We were able to do fall screenings. We had about 50 attendees. And we really have started to create partnerships with our physical therapy program at Marquette University. And that was great. The students were able to do a ton of fall screenings, really detailed balance assessments. And that, again, was very well received by the participants who were with us. We were lucky to have some great media coverage, thanks to the work of Suzanne and Chris to put together a really nice press release. And so we were able to really amplify the message within our community, which was fantastic. And we've got a strong partnership with our EMS providers, and John Bilat, who's in the bottom right there, was able to speak to that a little bit as part of that press release. So just some overviews of kind of the successes and challenges we ran into with our project. These were really rich events. We had high levels of engagement. Everyone who was there was like having a great time. And so I think anytime you've got that energy around it, it really makes things more successful. We've been really lucky and thankful to have the health profession students engaged in our events. I think it increases the engagement with the community, but it also really helps to create a pipeline for future focus on healthy aging and fall prevention and our new clinicians. By creating those relationships, I think we've created a nice framework for sustainability. With the LEAF grant money, we were able to create that kind of base of stepping on materials, the resource board, all the things that the site would need, and leave those with the church. And now that we've got one trained facilitator and two are hoping to go through the class, we really hope to be able to continue to sustain that within that site. The other piece that I didn't talk about before is that we've worked a lot with our EMS within the city of Milwaukee and their mobile integrated health or community paramedicine program. And so they've been taking toolkits that was also part of what we were able to purchase with our LEAF grant, and use that as part of their outreach when they're following up with individuals. So through some of the education we've done with them and providing these fall prevention toolkits and screenings, we're able to reach, again, a more vulnerable population. Some of the challenges that we ran into was, as we started to try to find the right fit and the right church community for us to work with, is that there's a lot of efforts right now around health equity, and there's a lot of work to try to engage faith communities. And so sometimes we found that there were a lot of different things, whether it was, heart failure or other, health promotion efforts going on, that we had to kind of queue up and see who the right fit was at the right time. The other thing that we found was the communities we were working with, a lot of the older adults were either still working full-time or part-time, or were serving as caregivers or childcare for their grandchildren. And so we had to be really strategic in terms of thinking about when we offered these. So we actually did our seminar and our on a weekend. And then we really worked to kind of find the right time to be able to offer our stepping on class to meet the needs of that group. And then, of course, we really were trying to create that diverse guest expert pool. And that was a challenge. And guest experts, as I'm sure Suzanne and others know, is a challenge sometimes with stepping on anyways. And so, continuing to cultivate and build those relationships so that we have a more diverse panel in the future. So that's our program, and it was lots of fun, and we can look forward to continuing to do this work.
Awesome. Thanks, Susie, for sharing. There's a question from Ashley in the chat, if you could share what you included in those toolkits. Maybe if you could send me
we've been working with those for the last couple of years, and we're continuing to tweak those, but we really built it off of a lot of the materials that come from the CDC's study programs. So it's the Stay Independent brochure, the 12 questions screening, home safety. And then we also put together like kind of a one-pager about resources in the community, some simple exercise pieces. So I can share the link to our website. We actually have the whole toolkit available electronically on our coalition website, so people can download those as well.
Yeah, that'd be perfect. Thank you. Any other questions for Susie?
Can I speak? Can you hear
go
me?
Ahead. Yep.
I wonder if there's not a way to find, I had a major head injury when I was 36. I have no balance because my right ear is gone. I use canes only, but I fall a lot. And I wonder if there's any information on what is the best support thing, meaning, a walker. My doctor says a wheelchair. I'm not going there until I get old, and I'm only 80, so that's not going to happen for a long time. But if there's any information out there for those of us who have issues with balance, and I couldn't stand on 2 feet with my arms out and not fall down. So just wonder if there's any kind of information that would make it easier, better, less often.
Yeah, that's a great question. Typically what we recommend is follow up with a healthcare provider or physical and occupational therapist. We also just developed a new website, fallfreetwi.org, where we have a ton of resources on there for you to check out. I'll drop the link for that in the chat. But for those people that do fall more frequently, you might be more apt to a specialized treatment or specialized therapies from your healthcare provider. But I'll drop the link for Falls Free Wisconsin, and then there's tons of great resources on there too.
Okay, thank you.
You're welcome. All right, then moving on to Megan with Jackson County.
Hello, everybody. And just to piggyback off what she had said too, Susie, I've noticed a lot of our participants, when they do some of the evidence-based programs with myself, find it more fulfilling for them to do that stepping on, because they have those professionals that come in and give you advice and stuff like that. So if you just want to find a stepping on near you too, that I've had a lot of community members benefit from stepping on.
Thank you.
All right. And then can I share my screen? Maybe. There we go. So I'm going to share a couple of things here. So we did the Stepping On program, or the bingo size program. That was all new to us. We started that last year after obtaining a LEAF grant. We did the facilitated with our dementia care specialist, Darby, who also is over at Interfaith Volunteers a couple of days during the week with Time for You. We did that to try to get a partnership. We had a partnership with Interfaith already established, but we wanted to continue that. So we had her be facilitized, as well as the director of the activities at the hub, where we normally hold our bingo size. It was our very first bingo size, so the participants got to learn with me. which was fun because everybody likes to play bingo and get prizes. But at the same aspect, it was kind of, we did the exercise only, and Bingo Size has 4 different platforms that you can run with. We chose to do the exercise only first. It is a 10-week program and it goes 2 days a week. Our first session included about 15 participants, and with our rural Jackson County community, I get a lot of repeats participants that come either from Stepping On, and then this is a new program, so they want to come and check that out, or from here, go to Walk with Ease. So I kind of get an overlap of them. But that means too, if they come to like one Bingo Size and they're, oh, this is fascinating, I like doing this, let's focus on getting some of my people that I go to, Coffee Clutch with, or I play games with at the hub that don't stick around to do Bingo Size, and have them come and sit in on one, and they end up joining the group. We did more toward social isolation and loneliness. I found a lot of my new participants that would come weren't very established in the community. They were new community members. We ended up providing transportation for those members in the first couple of weeks, and it didn't take them long to find a table that they kind of clicked with, and from there they started just carpooling together. But Bingo Size focuses around the exercise one that we did was, it went more towards small light exercise, including exercise bands, stress balls, kind of maintaining that balance. And when you started with the regular, over here, I don't know if it does it that way. So if I get rid of that, oh, sorry, I have a couple I want to share. So this is the packet that comes with it. This is the next one that we're doing for falls prevention. So as you can see, you start off with like a little blurb. It's kind of like a, this is what we're doing for Bingo Size. You do 3 bingo rolls and then you ask questions. So they're learning about falls prevention, and they're also having the fun game of bingo. Some things that we incorporated with the Bingo Size was some of the products from Fresh Baby. I don't know if you've ever been connected with them. They have a lot of resources for nutrition, falls, exercise. We utilize the water bottles that had a certain intake on them each day. We purchased Car Assist, which is something that would help for falls prevention for the elderly in our community, that help you get in and out of the vehicle. If you were, going to the doctor's appointment, a lot of my participants I would use for, like, if they got blackout is one of those bigger prices. Everybody wanted to get blackout to get a Car Assist, and we went out and demonstrated how to even use it in the car. They really enjoyed that. Something that they wouldn't think could prevent them. Now they're trying to get that in their cars. They're like, I need one in my purse, I need one in my glove compartment, because they don't always ride by just themselves. Sometimes they ride with friends. But it was really enjoyable for all of our community members. We just went out and we're doing another one in February, and it went out in our local Banner Journal this week. Yesterday was Wednesday, and I've got 5 people signed up. We are going to try to do a virtual option we're going to try to do a virtual option. Can you guys see that picture? Yep. Our sustainability for this is we had purchased also with the grant Kindles, one of which we use to utilize Bingo Size with music. Anything that we order from is off the CHW Kindle. And then we have 9 other ones. Our goal is to have 5 of our community members that are rural that have internet access right now to try our virtual platform for Bingo Size. Like I said, our focus is on social isolation and loneliness. And just because that you're homebound or you don't have transportation, you can't get, we're having big transportation issues here in Jackson County with our taxi services. And we want to be able to have those people engage with their population in the community as well. So we put it out there in our press release, in flyers, on social media, on WWIS, that we are looking for 5 people to try the virtual platform, to try to get them to still engage with us from home. So that's going to be something. I have one lady that has done the Bingo Size in the past, and she loved it, but she suffers from MS. So it could be something that her one day she's really, really good at it. The next day she's not able to leave the house. So we're hoping to get her set up with the Bingo Size virtual platform. And then when she does come into Bingo Size on a good day, she's able to let other people know. And then those people can tell their friends that aren't able to come with them, hey, Megan does this virtual Bingo Size. You should really get connected with it. But this is just some of our participants. Like I said, we had 15 last time. I'm hoping for more this time, but we'll see. This is Darby, our dementia care specialist in the black. So you have black Bingo Size facilitators that wear the black shirts. And then we ordered an abundance of the white Bingo Size shirts for anybody that got blackout, which was really good for our marketing for Bingo Size being in our first class. We actually had one of our participants that's a snowbird and leaves for about 3 weeks to go to Arizona. And she said she wore her Bingo Size like 2 days out of the week. Just so they knew that she was our participant in Bingo Size in Wisconsin. So that was really great. This was our group. We had one of our participants there actually that goes for Time for You, that suffers from dementia and Alzheimer's. His wife gets him very active in the community. So he was coming to every single Bingo Size, and we wanted him to participate so that way Darby, our dementia care specialist, knew how they would respond in their environment over at Time for You. And he loved it. He didn't like all of the exercises, but he really liked the fact that he could play bingo. So he did do all of the exercises reluctantly, but he did he did do them. And this is our group of sisters that come in. And it was just a really great, like I said, a very big learning tool for us. And from there on, it's really just grown for Jackson County. The LEAF grant alone, paid for the Bingo Size boxes, a lot of the participant giveaways, facilitating and certifying 3 of us, myself, the DCS, and our activity director at the hub. And we partner with the hub a lot. We do the Walk with Ease through the hub, and then it also helped us help the participants that come pay for their membership during the 10-week program for the hub, which further puts a plug in for that because they offer a lot of game nights, a lot of certain like different education pieces. Annette, our activities director, can come in and put plugs in for what they're doing for there, which increases their participants for our hub too. And the hub is somewhere that's only for 60 and older or disabled, so it really hits our ADRC population.
Awesome. Thanks for sharing, Megan. I love the interaction between the falls prevention and the social isolation piece. I think a lot of people are seeing with that with their programs. Question in the chat about the flyer and if you're able to share that or not. It sounds like someone's doing Bingo Size and wants to use that potentially. And Jenny would love to see that in more detail. I think that was when you were sharing the exercises, but I think you can't get that until you become a facilitator. So
right. Yeah. Once you're a facilitator, you get like this whole website where you can go on and you can get your certificate, the leader packet, all the questionnaires, and all of that. And that's really the only place that you can get it. And then you kind of pick and choose where you're at, where you're with your participants. Because like I said, they have falls prevention, exercise, range of motion, and nutrition, I think, is their facilitator packets. The range of motion ones seem to be more fitting for our people suffering from Alzheimer's and dementia because there was a little bit more in the chair kind of focus rather than up and moving around, which can kind of get them to be a little bit more foggy on what they're doing. But I mean, like I said, Jackson County really, really benefited from having that program. And I can certainly share that too. Yeah,
that'd be great. Another question, if you do a virtual option, would that be open to all Wisconsin residents or only Jackson County residents?
I'd like to do it with just the Jackson County residents being an evidence-based program. But more to come on that. It kind of depends on, I know the state was kind of looking for people to push that virtual option. That's why we purchased the Kindles to begin with. But with us being so rural, I might have somebody out that's, 25 miles from town that's not going to get internet service. So my goal is to get that sustainability to be able to purchase the hotspot options that can still be paid for by the ADRC in some way so that we can still keep them connected. So more to come on that. It's kind of a learning curve for me right now.
Mm-hmm. Yeah, that sounds good. Okay, any more questions? Feel free to drop in the chat, but we're going to move on to our last Leaf grantee report, Carly, who's also going to talk a little bit about bingo size, but they did bingo size a little bit differently.
I need to leave. Bye. Mhm.
Good morning, everybody. Are you able to hear me?
Yes.
All right, thank you. I'm a little under the weather today, so I'm going to leave my camera off. I do apologize for that. But I am a trauma injury prevention coordinator at Gunderson Health System in La Crosse County. And so at Gunderson Health System, we do see a lot of falls. Falls are by far our number one cause of injury in older adults. So we have already been doing some falls prevention efforts throughout La Crosse County and throughout our service region for a while. But after COVID, we decided we should kind of explore what other organizations within our county were doing to make sure we weren't overlapping some of the work we were doing. Our county health department and our ADRC had previously hosted some bingo size classes in the community. So while we also hosted bingo size classes, we were interested to see if they were still doing that. And after reaching out, we had discovered that a lot of priorities had changed for many organizations in La Crosse County, and they felt that they were no longer able to support that specific program. And we chose to focus on bingo size because that was a program we had already been doing. Myself and my coworker, who was another injury prevention coordinator, we were both certified bingo size facilitators. And we had been to several assisted living homes throughout the area. And each of those assisted living homes had already reached out to us asking us to host a second program. Their residents really liked it. They had some new tenants arrive that they thought would benefit from it. But since there was really just two of us that were certified that we knew of in the county that were able to host those programs, we determined that we really needed to come up with a plan to build on our capacity and what we were able to do with falls prevention in La Crosse County. So we did develop a few goals that we were looking to accomplish with this grant. Our goals were to expand capacity and increase access to evidence-based falls prevention programming in La Crosse County. And we determined that focusing on assisted living homes in the area was really important to us because we worked with our local ambulance service who developed sort of a heat map for us to show us where falls were occurring most often. Since, as we know, most falls occur within the home, we were trying to determine where those people may live. And an overwhelming amount of assisted living facilities were coming back with several falls with their patients living there each year. So we decided that we were going to partner with some assisted living facilities within La Crosse County that were willing and able to have at least 1 to 2 members of their staff become certified in bingo size. So we were able to reach 15 new facilitators that had never been facilitators for a bingo size program previously at 9 different facilities who agreed to provide a bingo size program at least once per year over the next 2 years for residents in La Crosse County. So again, we did partner with 3 separate organizations, 9 facilities overall that were committed to expanding our capacity for evidence-based falls prevention programming. And we, again, chose bingo size just because we were really focusing on those assisted living facilities. We do have a goal to reach 100 older adults that would participate in bingo size over the next 2 years in La Crosse County. At our last check-in, which is in the fall of 2023, we had totaled up that we had about 45 people that had participated in a bingo size program at that point. So we are on track to meet that goal of reaching 100 older adults that would participate in bingo size over the next 2 years in La Crosse County. We determined that the specific assisted living facilities that agreed to partner with us all signed a memorandum of understanding that agreed to meet these goals or work towards these goals with us. So once each facility had their designated staff complete the bingo size facilitation training, we then worked to set up dates where we would do fidelity checks with each facility. So either myself or my coworker went to each facility, observed them facilitating a bingo size session, and then we were able to give them feedback, provide any necessary improvements or modifications that they maybe weren't quite sure how to do. We provided some technical support to just making sure that everyone had access to the bingo size exercises that we're asked to do. I don't know if the other grantee that worked on bingo size noticed that sometimes the descriptions of the exercises in the bingo size manual are a little hard to understand. So it was a really big benefit for us that Western Kentucky University has videos that demonstrate each exercise. So we were able to kind of facilitate some technical support with those who didn't have quite a clear understanding of the exercises that we were asked to do. We also wanted to address some disparities and barriers that were identified in our initial meeting with the facilities that we were working with. So the bingo size program really targets more sedentary older adults at all ability levels that kind of had a wide range of what they were capable of doing. Each facility also noted that they really didn't have a lot of extra funding or support to purchase supplies or additional trainings that were not already implemented in their budget. So the grant really did cover the cost of the facilitator training, obtaining the bingo size license, and purchasing the supplies and prizes necessary for the program. So by providing bingo size in-house for free, it did eliminate the hurdle that a participant may need to jump over to access a falls prevention program. So neither the participants or the facilitators or those senior centers had to pay for that initial purchase of bingo size and getting the facilitation. Another common barrier to falls prevention programs that were identified throughout the period were that many other prevention programs require that participants are primarily able to walk independently without the use of an assistive device like a cane or a walker, whereas bingo size is really suitable for varying levels of ability. So again, that was just another way that we were looking to overcome some of those barriers. And then again, since it is an evidence-based approach used to develop bingo size, metrics to assess the effectiveness of the program were already established. So it was really easy for us to collect some of that data, send it to bingo size, but also keep it on our end for our understanding of, the participants' perception of their success throughout the program. That's something we really wanted to keep up with as well. And then looking to project sustainability and next steps. It was our original hope that by providing that initial financial assistance to assisted living facilities to fund the bingo size program, there would be an increased incentive for these organizations to continue funding this program at their locations after the 2-year certification ends. Because costs of licensing and training renewal fees are offered at a reduced rate through the bingo size program in Western Kentucky University, and they would already have the equipment, so they wouldn't have to take on that burden either. We did make sure that each facility knew that if there, for some reason, was an issue that came up or a facility was unable to pay for the renewal costs, we would continue to seek alternative avenues of funding to make sure that facility was able to stay up to date with their certifications. And yeah, so overall, we feel that our program was a real success. We were able to expand our capacity. Instead of having just myself and my coworker being certified in bingo size, there are now an additional 15 facilitators within our county that are able to host this program as well. So we are pretty proud of the way we were able to kind of collaborate with each organization. They were really supportive of us, and they really appreciated us coming to them to try and offer them new ways and new activities to get their participants to exercise while keeping them entertained. We just finished our own bingo size program at a assisted living facility that was not part of this grant program. And they said they heard about it because they had seen it on the news. We did a lot of media coverage. So they actually reached out to us and asked us to host a program there. And, you know, without fail, every time we get to that 20th session, they're like, can't believe this is over. We really want you to come back. Can we just start the program over? Can you guys keep coming? And while we would love to do that, you know, we're continuing to go to places that we haven't been before. But it is really nice to hear and reassuring to hear that they do feel we're making a difference, and they do feel that, you know, these exercises are helpful. I had one resident in particular who her first day, she could not even stand to do the marching in place for a full 60 seconds. She came to bingo size every day in a wheelchair, and by the last session, she was walking to bingo size with her walker, and she was able to, you know, continue the exercises for a lot longer period of time than she was originally. So we kind of made our own award and gave her most improved. And, you know, they really, really did appreciate it. And that was just kind of rewarding for us to see that the work we're putting forward is, you know, really truly being a successful effort, and people are improving. And it's always kind of a running joke that they're like, oh, we're in our 90s, like we're never going to get muscle, we're never going to get strong. But by the end, they all kind of realized, like, I can do this, and I can build muscle, and I can sustain these exercise programs on my own. So yeah, overall, we felt our program was a great success, and we really appreciated the ability to, you know, collaborate with these organizations through the WIHA grant. So again, thank you for that opportunity.
Thanks for sharing, Carly. I love hearing those kind of stories. I was able to participate in a bingo size class in lacrosse as part of our media tour for the Falls Free Wisconsin initiative, and it was really fun. I agree. So thanks for sharing. Any questions, feel free to drop them in the chat. But otherwise, we'll turn it back over to Jill.
Great. Thank you, everyone. This was such a great illustration of some awesome fall prevention work and healthy aging work overall. Thank you all for doing this great work, and we hope to continue it. So like Suzanne alluded to before, many of you may have heard, but we are working on some legislative projects. We have 2 bills introduced, one in the Senate and the same one in the Assembly, to expand this opportunity to be able to take these LEAF grants and make them available, whether that's later in 2024, that's the ultimate goal. But what we hope to do that. So we encourage you to contact your legislators. I can't talk this morning. And make sure to illustrate the importance of these healthy aging grants. Whether we're going to focus on fall prevention, other healthy aging initiatives that hasn't been quite decided yet when it comes to future endeavors in this, but we would like to be able to continue this great work going forward. So contact me if you have any further questions on that. I know that a lot of you have been reaching out to your legislators. We really appreciate that, but the more that they can hear about fall prevention and the importance of it, as well as other healthy aging initiatives, we know that the state of Wisconsin and nationally, the older adult population is growing so exponentially that we're going to need much more services. We're going to need much more support when it comes to these programs. So with that said, I am going to illustrate a little bit of an idea of how WIHA is addressing these funding issues going forward, how we are shifting our focus here at WIHA to expand, to be able to meet the needs for these increasing older adults populations throughout the state. So as many of you know, over the past year, we've really expanded our mission and services to not only include evidence-based healthy aging programs, which is still going to be our base focus, but what we've done is we've really also focused on greater public health initiatives while continuing our support for those evidence-based healthy aging programs. You've seen our involvement in the Falls Free Wisconsin, as well as a Social Isolation and Loneliness Coalition. Our involvement in that. We've been taking some attempts to increase awareness on brain health and ageism wellness overall. So there's definitely some focus areas that we've been working on over the past year, and we will continue to work on even more going forward. We're really focused while we're doing that on establishing relationships with our communities, with older adults in Wisconsin as a whole, in order to increase awareness of health education opportunities, awareness of all the great work that you all are doing in your communities, and really to increase readiness to engage in programming, because we only serve about 1 to 2% of the population with our evidence-based programs. We want people to move in that direction to be able to attend an evidence-based healthy aging program, but that's not necessarily going to happen unless we help engage them and help increase their awareness of the fact that they can take control over their health. And there are things that they can do to age healthfully. So that's really our goal, our health education goal. And this is really to, like I said, pull people more towards the services that you are offering and really engage them in healthy aging, kind of a whole healthy aging movement. So an example of this is how we've done this over the past year is our Age Well newsletter. So most of you should be getting that newsletter. And if you're not, contact us, let us know. We want to make sure that you are getting that. You can sign up on our website to be able to receive that. And that is geared towards just older adults themselves, towards all of us as we age. And so that is going to continue. And then parallel to this expanded mission and parallel to engaging and increasing awareness on healthy aging overall, we are needing to shift how our organization is funded. We are a 501(c)(3) nonprofit, for those of you who are or are not aware. And we've been almost exclusively funded by grants in the past. Those grants are drying up and they are no longer available. So we want to make sure that we're continuing the great work here in Wisconsin. We're able to offer you opportunities in your communities and support all the great work you're doing. So with those larger grants not available, like they used to be, we are shifting our focus to a more traditional nonprofit funding strategy. So we have hired Courtney Meyer, who is with us today, and I will let her give about a little 1 or 2 minute overview of what that looks like in how we're going to move forward with that.
Yeah, thanks so much, Jill. Like Jill said, my name is Courtney Meyer. I live in Wauwatosa, so I'm in the Milwaukee County area, and I have worked in nonprofit since 2006. So I'm super excited to, I think, be the first like actual development person at WIHA. Most nonprofits do have a development person or a development staff. So it's really exciting to bring this type of work to WIHA. And like Jill said, we're shifting in terms of we're adding new things to our funding streams, which everybody here has their favorite nonprofits that they give to, that you understand why you're giving and the great things that nonprofits do with these donations. So we're really just adding to our funding streams in these exciting ways. We'll be asking for donations more often and telling you why we need those donations. We'll be appealing also to the general public. You don't have to take a program with WIHA to give to WIHA. You just need to understand the impact. So we're really going to be working hard to show that impact. And I don't want to take a ton of time, but you'll probably be seeing things from us that look new to you. So let us know if you have questions. We'll be increasing our sponsorship opportunities for new events. We'll be writing for new corporate gifts, and we'll really be sharing testimonials from everybody because everything you've shared today, you know, Anne at the Oshkosh Senior Center with that 91-year-old woman, like that's exactly what we need from you, because those stories are golden to our organization and to all the work that everybody is doing, is really sharing those stories, and then we can really share the impact of the work. So you'll be seeing in the newsletter that goes out after this call, you'll see ways in which you can share testimonials with us so that we can really incorporate those into our fundraising work and our communication work. So yeah, that's kind of the fundraising plan for 2024, the short story version. So thank you.
Great. Thank you so much, Courtney. Sorry, I'm trying to unmute myself and change the slides at the same time. But yeah, so we do have opportunities. There's easy ways to submit testimonials for all the great work that you're doing. You can do it on our website. There's, as you can see on the screen, there's a button on all of our program pages now. Participants can go in and submit testimonials, as well as on our program resources page that you all utilize for facilitators and our program providers. So of course you can always email us too, but those are some easy ways that you can get connected to that. And we appreciate it and thank you for helping us to help you to get the word out about healthy aging overall. So with that, we do have 5 minutes left. We were going to do some breakout rooms, but I love these LEAF grantees and how we really expanded on the great work that and talked about what was happening. So we are going to table this and put it on our next office hours. And I'm going to just take us real quickly to our program updates and hand it over to Amy.
Thank you, Jill. Good morning, everyone. So I'm just going to do a couple quick updates. So for anybody who's interested in having anybody trained for any of the chronic condition workshops, as you know, we at WIHA are not offering those workshops, those trainings, excuse me, this year. But there is an opportunity to be trained through the national office. And there are some trainings coming up in February and in March. So if you have anybody who's interested in becoming a facilitator for any of the chronic condition workshops, please just feel free to reach out to me and I'll get you connected to the national office for that. Another quick reminder on any of your community workshops, we're still asking that you send in your data packets in a timely fashion. So we would really love to see those be submitted to WIHA no more than 2 weeks after your workshop. So if you can do that, we would really, really appreciate it. And then last, there'll be more about this in the newsletter that goes out next week, but Doctors Heidi Brown and Megan Piper have a new research project called Women on the Go. And this project is focused on how to best support women to prevent or improve bladder and bowel issues and leakage through a self-paced online program. And they are looking for some more participants. So I will drop in the chat the link on how to get some more information, and then watch for the more information in the newsletter. And that was really, really quick, but I want to pass it on to Suzanne so she can give some updates as well.
Thanks, Amy, and I'll try to be really, really quick too. So just 2 quick reminders for stepping on facilitators. I did send up some updated pages for stepping on in mid-December. So just wanted to remind you all about those. If you haven't printed off those new pages for the facilitator manual and the new handouts, make sure that you're replacing those pages. Just some minor changes for session 5 and the vitamin D section. So I worked with the program developer, as we know the research shows that it's more difficult for people with darker skin color to get the recommended amount of vitamin D. We wanted to reflect that in the manual. So those were just the minor changes. And then we are holding a peer facilitator gathering on February 7th. So you should have received information about this. If you have peer facilitators in your Stepping On program, we'll be discussing kind of the updated curriculum, just a refresher of the role of a peer facilitator. We'll go through some WIHA updates and offer time for question and answer and feedback for the peer facilitators. So program providers are welcome to attend to that event. You don't have to. If you have certified facilitators that manage your peer facilitators, those facilitators are welcome. But again, this is more so just for those peer facilitators to get together and kind of learn and hear from each other. So I'll drop the link for both of those updates that went out in the chat.
Thank you, Amy. Thank you, Suzanne. All right, so the last agenda item we have today is just let you know our future office hours. We were just meeting in January. We'll be meeting in April, July, and October. We tried something new this time and did calendar invites. I'm not sure that was the most efficient way to do that. So what we're going to do is we are going to have email reminders come out, and then you can just go ahead and register for that. So just watch for emails from WIHA and our WIHA updates, and then we'll send out a reminder and you can just register for the office hours that way. But we really, really enjoy having you all on, and we look forward to continued discussion. throughout the rest of 2024. We look forward to supporting evidence-based healthy aging programs and initiatives throughout the state and also nationwide. So thank you very much for joining us. Please don't hesitate to reach out to any of us at any time, and we look forward to hearing from you.